Hello, I'm Dr. Jack Adrian of ChiroCenter, and in this short video, I'd like to share with you how to do a self-posture examination to check yourself for any distortions in your skeletal structure that may be causing a problem with pain or some other kind of health challenge. Now, this examination is much like a screening examination you would perform on a child's posture that I share here on YouTube in another video. But unlike a child, an adult can be shown how to self-exam just by looking in a mirror. Now, of course, an assistant will still be needed to help you with a side and back view of yourself, which can't be seen in a mirror's reflection. And at the end of this video, I will also share with you where you can find a posture exam form to record any challenges you may find in your self-exam. But the best way to get started is to follow me as I guide you through this simple screening protocol so you can see how it's done, and then when you have your form, you can go back and record your findings. One of the reasons posture problems develop into more serious problems is that as adults, we tend to look right through the problem, often for many years. This is sort of known as the can't see the forest because of the trees phenomenon. Many people spend hours in front of a mirror each month preparing to present their best image to the world. Yet they look right through and they fail to see their own postural distortions in that same mirror. Unfortunately, posture distortions are things that, well, they're things that makeup just can't hide. And very often, postural challenges are the first things that other people see in us. Beyond that, unlevel posture is a very commonly overlooked cause of many pain syndromes. And if your body is presenting you with some kind of mysterious or recurring type of pain, know that postural distortion is very often the cause of that pain. As we begin our posture screening, it's important to understand we're not just looking for the blatantly obvious structural challenges that you may be having, but also the hard to see ones, because even minor structural distortions can cause significant pain and other health challenges. Now, this is Jill, one of my wonderful assistants here at ChiroCenter, and she is going to assist us as I talk you through the basics of doing a home posture exam in front of a mirror. So if you will, go to a mirror, preferably one that is full length, but if not, at least one that you can stand back far enough to see yourself from the waist up. With your body at ease and no conscious straightening, now this is very important, body at ease and no conscious straightening. In other words, just stand normally. Does your head sit level on your shoulders, or does it tilt to the right or to the left? In checking for abnormal neck rotation, is your nose in the midline of the reflection in the mirror? Or do you see a fuller view of the left ear or of the right ear? Next, are your shoulders level? Or is the right shoulder lower than the left? Or perhaps the left shoulder lower than the right? And as you look at your shoulders, if you are female, ask yourself this question. Does your purse or bra strap tend to slip off your shoulder easily? And if so, is the low shoulder side the problem? Does one of your shoulders seem to lean forward of the other? Can you tell if both shoulders are high and erect, or do they both slump forward, even slightly? Now look at your body from the waist up. Are you straight? Or do you lean slightly to the left or slightly to the right? In looking at your hands, are your hands level at your sides? Or does the left hand hang lower than the right? Or perhaps the right hand hang lower than the left? Now take a look at your belt line. Is the belt level from left to right? Or does it ride higher on the right hip or on the left hip? Now looking at the feet, do both of your feet point straight forward? Or does one of your feet point outward more than the other? Now at this time, ask your assistant to view you from the back. And again, with no conscious straightening. Does one of the shoulder blades protrude out farther than the other one? When you ask them to bend forward, does one of the blades drop lower than the other? Or does it protrude out even further? And as you have them lean even farther forward, being barebacked or with their shirt up, which we won't do in this video, does it appear that they have either an S-shaped curve or even a slight C-shaped curve in any part of their neck or back? And what we're looking for is anything other than straight as an arrow. Now again, using the help of your assistant with them viewing you from the side, and once again, standing normally with no conscious straightening. This needs to be done standing normally. Check and look at their ear and see if the center of their ear canal lines up directly over top of the center of their shoulder. Or does their head lean forward, even slightly, from their shoulders? If the center of your ears is leaning forward of the center of your shoulders, does there appear to be a developing hump at the base of your neck? If so, this could be the beginning of Dowegger's hump, the significant forward leaning most people often see as they grow older. So folks, that's how easy it is to do an at-home posture exam. And while you're at it, be sure to return the favor to your assistant and help them examine their posture as well. Again, some distortions may be blatantly obvious and others may be quite hard to see. Now, in its early stages, unlevel posture leads to significant tiredness and fatigue in the muscles as they try to hold you more erect in your center of gravity. In its later stages, often as early as age 35, abnormal posture, unlevel posture can be seen having caused serious disc disease and joint decay, often leading to lifetime pain and other health challenges. So, as you can see, unlevel posture is really nothing to be taken lightly. Now in just a minute, I'll share with you where you can go to get your posture exam form to record your findings, as well as a scoring system to help you determine the depth of your postural challenges. But first, if you found no problems in your posture, I want to congratulate you. In all likelihood, you are someone who is full of energy and vitality and enjoying life to the fullest. On the other hand, if you did find posture problems in various stages of development, know that it's always easier to prevent a problem than to deal with it. And it's almost always easier to correct a small problem before it develops into a big one. If so, I invite you to call me here at ChiroCenter for a complimentary consultation where together you and I can sit down and discuss any concerns you may be having. Once again, I'm Dr. Jack Adrian from ChiroCenter. I thank you for watching. And now here is where you can find your posture screening forms to record your posture findings.